Westmoreland Community Connections is a presentation of St. Anne Home.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce.
Hello and welcome to Westmoreland Community Connections. I'm your host, President and CEO of the Westmoreland County Chamber of Commerce, Chad Amond. I am delighted to have on the show today Laurie Barnett-Levine. She is the Executive Director for Mental Health America of Southwestern Pennsylvania. Welcome to the show.
Hi, thank you very much for having me on this morning. I appreciate it.
Laurie, tell the listeners what is your background and how did you get involved with Mental Health America as the executive director?
Well, I'm a licensed social worker, and I had been working in the field for decades. I'd been working mostly in Allegheny County, providing services in a mental health center. But I also did work with Mental Health America in Allegheny County. And when this position became available, it was something that really interested me. Advocacy and education has always been my passion, and I just saw it as a perfect fit, and thankfully the organization did as well.
Well, we very much appreciate your interaction with our community. I think that the listeners need to know, tell us a little bit about Mental Health America and what the organization does.
Surely. This is our 55th year. The organization has been created to advocate for people with mental health issues. And we're part of a national organization. We're our own private nonprofit, but there's a national organization also called Mental Health America. And there are affiliates from across the country that participate in Mental Health America. And what we all have in common is advocacy and education. There's also a statewide organization that affiliates from across the state participate in. And our primary mission is education and advocacy.
It's a broad spectrum of mental health. How do you describe issues with mental health? I mean, are they anxiety and depression, or maybe that's the end of the spectrum and maybe suicide prevention is the other end of the spectrum? How do you describe to the listeners what describes mental health?
That's very interesting, and I also wanted to add that in the last couple of years, the agency added to its mission substance use disorders.
Okay.
So that we recognize that people who have mental health issues, many of them have coexisting substance use issues. And because of the opioid epidemic that is striking our nation and this particular community, we thought that it would be the responsible thing to acknowledge that we're including substance use disorders as part of our mission.
So the month of May is Mental Health Month, and can you tell the history and the meaning of this declaration?
Well, actually, Mental Health Month was created by our national organization, Mental Health America. And the reason that was done was to create greater awareness about mental health and mental health issues. And you asked me about what is mental health, and I think you can have a mental illness and be mentally healthy, and you could not have a mental illness and not be mentally healthy. And things that we talk about are stress reduction, anxiety, and good mental health can range from the ability to stay in the present, be mindful, be healthy, focus on the positive things, practice gratitude, all the way to serious anxiety, depression, schizophrenia. And people who have mental illnesses can learn to lead rich and full lives. It's what we call recovery, so that you can be in recovery from a mental illness. In other words, you have maybe depression, serious depression, or bipolar disorder, but you have it under control. You take your medication, you get really good sleep, you have very good nutrition, and you're able to work and participate fully in society. And some of what our organization does, and our national organization, is we try to create awareness that there's a stigma about mental illness. Sometimes people see it as a character flaw, or they see it as that you're less than, that something's wrong with you, and that we want to erase that stigma and to help people realize that having a mental health issue is no different than having a physical health issue. If you had cancer, you wouldn't wouldn't be embarrassed that you had cancer or heart disease. You wouldn't feel stigmatized that something was wrong with you if you had diabetes. And I think that, mental health issues can be related similarly to diabetes. You can have this illness, you can learn to adapt, you can change your diet, and you can participate fully in society. So that's information that we want people to know. Because if people feel that it's a character flaw or you're less than, they're not going to be likely to seek help. Now, we want people to know that they can seek help. Our services primarily are based in Westmoreland County because that's where our funding comes from primarily, but we also provide education and advocacy throughout Southwestern Pennsylvania.
You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. We're talking with Laurie Barnett-Levine. She is the Executive Director of Mental Health America of Southwestern Pennsylvania. Laurie, in today's environment, I feel like everyone is stressed. And so how do you understand that you need to get advice or you need to connect with Mental Health America? I mean, everyone is stressed. What is the top of the ladder to address that?
Well, I think people have to recognize when they're feeling stressed, when they're feeling anxious, what those symptoms are. We also try to create greater awareness around suicide and suicide prevention. An article recently came out in the medical journal that people who experience depression, anxiety, and stress actually increase their chances of having a cardiovascular event. And so they've done studies with siblings, and so one sibling may be raised the same way as the other, but it's how they experiencing the stress and anxiety, how they cope with the stress and anxiety. But the bottom line is everyone is different. And so when you feel that life is getting out of control, if you have a loved one that you notice is having trouble maybe eating, maybe sleeping, maybe functioning in the real world, in cases of schizophrenia that often develops in young adults, where you might see them having actually hallucinations or delusions, and they may not realize what reality is. And so it's by paying attention to other people. Suicide awareness. It's really okay to ask someone if they're feeling suicidal. People are afraid to do it. They think, if I do this, I'm going to put that into their head, when really it is in their head already. And they might feel tremendous relief that you have invited them to talk about it. So I think that creating a supportive, nurturing environment where you're open to being able to talk about mental health, just like you would physical health, and to have that person get help. There's many agencies throughout Westmoreland County where a person can receive help. There's also a national suicide hotline, and that number is 1-800-273-TALK or 273-8255. And they have a special line for veterans where if you press 1, actually, then you can be able to talk to another veteran. And that was set up specifically because the number of veteran suicides has reached an all-time high. But I have to say that in our society recently, and they really don't understand it, but suicide has reached an all-time high. So nearly 45,000 lives were lost to suicide in 2016. And the suicide rates went up more than 30% in 1999. And they continue
30%.
to climb.
Wow.
And in Westmoreland County in recent years, we have also reached an all-time high of suicides. So not only do we have an opioid epidemic, but there's also issues related to suicide. And 54% of the people that have completed suicide did not have a known mental health condition. So it's really important to learn about suicide and create greater awareness. We're seeing that young people, younger and younger, in their early teens, are completing suicide because of stress, possibly because of bullying at school. And so it's really important to talk to your children and your family about mental health, to let them know that it's okay to come and talk to you and to talk to you about anything, that you're open and that you're there for them. Recently, the Center for Disease Control released a study that the lifespan has actually decreased in America because of suicide and because of the opioid epidemic. So it's really important. Suicide is the second leading cause of death of young people. So it's important to know the warning signs, feelings of hopelessness, saying, I just can't take this anymore, I don't think I want to live, giving away key possessions, isolating oneself. So those are some of the warning signs, and you want to be able to talk to that person about it. In Westmoreland County, we know that the leading method of suicide is by gunshot, and it's usually middle-aged to older males. So those are some things to keep in mind.
Well, you referenced stress and anxiety and drug abuse for suicide. Why did the suicide increase by 30% in, you said 1999, it went up 30%? What is the summary of that?
Well, I don't think they really understand this phenomenon as to why the suicide rates are increasing and why so many of the people that complete suicide don't have a prior mental health history. There's a lot of study going on. Is suicide a brain disease? Are they studying the brains of people that have completed suicide, and are their brains different? Many people believe suicide is an impulsive act, that it's not a person necessarily wanting to die, but they want the pain to end, or they get in a situation where they feel cornered and they feel like there's no way out. At one point, they thought the economy had something to do with it, but the economy is better now. Yeah. And they're seeing more and more young people completing suicide. And I think it's less taboo, unfortunately. So the more that people know about it, they see it as a viable option. When we say suicide is a permanent solution to what could be a temporary problem.
So, what are some things that people can do to improve their mental health?
Well, I think that, there's things that people can do to improve their mental health. I mentioned them before. Make sure that you're getting good sleep. Exercise actually helps produce certain chemicals in the brain that make you feel better. Practicing good nutrition, having a support network, having people that you can talk to and go to, and for the loved ones, making sure that you're open and showing that you're available to talk to people. Other high-risk groups are people who are LGBTQ because they feel isolated, they feel alone, so family being able to talk to them, acceptance, those are some things. Older adults are feeling isolated, depression, they may have an illness that they feel hopeless about. Those are some of the warning signs.
You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. We're talking with Laurie Barnett-Levine. She is the Executive Director of Mental Health America on Southwestern Pennsylvania. We'll be right back after these messages.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of St. Anne Home.
Welcome back. You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. I'm your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce. Our guest today is Laurie Barnett-Levine. She is the Executive Director for Mental Health America of Southwestern Pennsylvania, located in Greensburg. Laurie, one of the things that we were talking about before the break is the stress and anxiety and the suicide increase in the entire country. But what services does Mental Health America of Southwestern Pennsylvania offer to address these issues in our community?
Well, some of the services that we offer is we do have an advocate that's available for the community. If anybody has questions related to mental health or issues, sometimes people that have mental health issues call because they're having difficulty knowing what services to access, how to access the services, or they may be having problems with landlords or other financial issues, and they can call that advocate at our phone number, 724-834-6351. Our website also is mhaswpa.org. www.westmorelandcommunityconnections.org. So we also have a representative payee services, but you have to be open and active in mental health services in Westmoreland County to be able to have those services. And we have a drop-in center in Latrobe. We also participate in a group called the Ray of Hope, and we house the Ray of Hope coordinator. And the Ray of Hope is a group of concerned individuals, agencies, family members, people with lived experience in mental health, veterans, that come together to create greater awareness about suicide awareness and prevention. And so that's a really, I think, a very important group and something that we do. And we'll go into the community and we will give talks. We will provide training for suicide awareness and prevention free of charge. All we have to cover the costs of are the printed materials. We also have a walk every year in the fall. You can look for more information about that at Twin Lakes, to create greater awareness about suicide and suicide prevention. We do have advocates that go to the various community hospitals. If you have someone who's there who is a patient on a mental health unit, we will go and we will talk with them. We will talk with the family and try to assist them. We also have an ombudsman at our agency, and the ombudsman helps people who have health insurance that might be having health insurance issues, having trouble accessing mental health services, so they can receive those that information from us as well. I also wanted to mention that as part of our mission for education, every year we have special events. And this year we're having a special event on May 2nd. It's something we do annually. It's called Innovations, and it's held at the Ramada. This year we're honoring people throughout the community who do special things related to mental health. We're giving a Lifetime Achievement Award to Dr. Lauren Roth. He's from UPMC, and he has had decades of experience participating in mental health advocacy, helping people to get services, understanding of mental health issues in the community, and UPMC is our premier sponsor, UPMC Community Care Behavioral Health. We're also offering a Community Advocacy Award to someone who's known by a lot of people in the community, and that's Tay Waltenbaugh. And Tay recently retired, and he's the former executive director of Westmoreland Community Action. And we're honoring another Westmoreland County group called Sage's Army. And Sage's Army was created by Carmen Capozzi and his wife in memory of their son Sage, who lost his life to an opioid overdose. And he has really been a fighter to create awareness and provide support for families who are experiencing a loved one that has an opioid concern, also that who's lost a loved one to opioids. Another person that we are honoring is Deborah Thakra, and she created a group called Feeding the Spirit that is in Westmoreland County and provides food, and actually they try to provide other resources for individuals who are in need. So by providing these safety net services, these individuals are shedding a light on how to achieve better mental health and how to provide support to individuals in the community. Another group that we're honoring is the Pittsburgh Ballet Theater. And we're honoring the Pittsburgh Ballet Theater because they have done work not only in Pittsburgh, but they have done work out here at Seton Hill University. And the president of Seton Hill University, Mary Finger, is on their board of directors. And they understand that dance creates good mental health. The movement, the exercise, it actually creates a spiritual rejuvenation. And they have done work with individuals that have special needs. They have the special ballets for people with autism, and they've had classes for people that have had special needs. So these are the individuals and organizations that we've chosen to shine a light on. And if you don't receive an invitation and you want to learn more about it, just call our number again. That's 724-834-6351. Another thing I also wanted to mention is we have a support group for people who have lost loved ones to the opioid epidemic, and you can call that number to find out more information about that.
That number is 724-834-6351, or go on to the website MHA swpa.org. We're talking with Laurie Barnett-Levine. She is the Executive Director for Mental Health America of Southwestern Pennsylvania, located in Greensburg. And Laurie, you brought up multiple people that I know, and they work with the chamber, and they are impactful for the community, feeding the spirit. Tay Waltenbaugh, I have so much respect for him. Sage's Army, Pittsburgh Ballet Theater, and the doctor from UPMC has impacted our community in such positive ways. And so if your calendar is free, or if you can scratch off your calendar to attend the May 2nd event at the Greensburg Ramada, I would strongly prospect that. And one of the things that, Laurie, the headlines for so many famous celebrities that are talking about mental health, what do you think about that? I mean, it's probably a positive thing because it's getting attention, and people that were, formerly shy about talking about mental health. Maybe it's a positive thing.
I agree with you. I think it is a really positive thing because celebrities are kind of like the tip of the iceberg around this mental health issue. By them being able to acknowledge that they have mental health issues and talk about them more openly, they're really setting the stage for decreasing the stigma around mental health. And there is some discrimination that goes on around people that have mental health issues. And so they open the conversation for people to learn about mental health and to talk about mental health. I think recently, Prince Harry is starting a show with Oprah next year where he has been very vocal and very active about mental health, both in the United States and across the world. And so someone like him saying that it's important to be able to talk about mental health really raises it on people's radar. And the celebrities are being open about it too. Some of them take breaks from their performances because they are having mental health issues and they're taking care of themselves. And they're really setting a shining example of what you should be and how you should take care of your mental health. Lady Gaga has created a foundation for people who feel bullied, and she and her mother go across the country and talk about that. So there's many examples of people who are shedding a light on mental health, and I do think it's a good thing.
Yeah, and the bullying thing, with everybody has a phone, and the kids, back in our day, when we went home from school, you didn't have access to the kids. I mean, with the social media, everyone is gaining feedback every minute and every hour, and so that's probably adding to the stress and anxiety.
I think so. Back in the day, so to speak, you went to school. If you were bullied at school, but you could go home.
Yeah.
And then you had a safety net. But now with phones and the internet and Facebook and LinkedIn, all these different things that people are, Instagram, there's so many ways to bully people, and it's difficult to not shut it off. And young people sometimes wake up in the middle of the night just to check their phones to see if they've missed anything. And so there's no reprieve from this. And so it makes it much easier. The anonymity of the internet makes it easier to bully people. And I think the schools are recognizing this and trying to create some mental health programs around this, and to try to find support for these students so that they have someone to go to and they have someone to talk to about this. And they should be able to talk to their parents about this, and the school should be responsive and try to take some steps to try to prevent the bullying. And I know that so many of them are, and there's many innovative programs that are taking place in Westmoreland County. So I guess it's around Southwestern Pennsylvania, but I know specifically in Westmoreland County, and that's a wonderful thing.
Right. Well, we're wrapping up the show. We're talking with Laurie Barnett-Levine. She is the Executive Director for Mental Health America of Southwestern Pennsylvania. Laurie, do you have any new programs on the horizon or things that you're working on to create new programs?
One of the programs that we're working on right now is that we own the building that we're in South Greensburg, and in the basement of the building it was not really used. So we have received some grant money to refurbish this area, and we're going to create an art cellar because art is another way for people to, it's an outlet for people to express themselves, and it can improve their mental health. And we're going to be working with art therapists, and the program we hope will open in the next 6 months. We've done extensive renovations, and so it will be open to people who are in mental health programs, but we're also going to have programs for the general public because art, is another method of stress reduction and improving your mental health. I forgot to mention that Mental Health America hosts 3 important support groups. One is for people who lost loved ones to opioid epidemic, and the other is called LOSS. It's for people who lost loved ones to suicide. And we also have a general mental health support group. So if you go on our website again, mhaswpa.org, you'll find more information about these.
So anything to wrap up quickly, anything you want to mention to the person that is listening to connect with your organization? You obviously you can go on to mhaswpa.org or call 724-834-6351.
Thank you. And May is Mental Health Month. So practice good mental health. Be aware of your mental health and the mental health of your loved ones. And it's okay to talk about your mental health. It's a good thing.
Thank you very much, Laurie Barnett-Levine. She is the Executive Director for Mental Health America of Southwestern Pennsylvania. Your impact on our community, obviously Westmoreland County and all of Southwestern Pennsylvania, we greatly appreciate your impact.
Thank you, and thank you for giving me the opportunity to speak to your listeners today.
You've been listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. Join us next week, same time, same place, for another edition of Westmoreland Community Connections. Thanks for listening, everyone.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of St. Anne Home.